interesting that a talk on digital technologies had the hiccup on digital technologies, use of digital technologies. So that's interesting. So anyway, I'm not a doctor, but I do have a unique perspective into the industry from outside to some extent, because for us in the technology space, we look at different domains, different industries externally, abstract it, and then see how we can solve some of the basic problems. When it comes to the medical field, there is a lot of technology today in use. I don't think anybody does any practice without use of technology. But it's uniquely interesting to see how it applies to primary care. Clearly, the theme of this whole conference seems to be that primary care is the foundation of public health system, which it is. It is the foundation. However, assuming this works, India has some unique challenges when it comes to primary care. First of all, as we all know, there is a shortage of primary care physicians. Second, the quality varies from place to place, from provider to provider, from institution to institution. Then access to care is expensive. There are direct costs, there are indirect costs. Those who can afford get quality care, those who cannot, do not. Then out-of-pocket expenses in India is one of the highest in the world. It's over 50%. I know the government is trying to do everything possible to reduce it, but it's still very high. In comparison, a country like the US is about 11%. So we have a long way to go. And every year, this is from Niti Aayog, nearly 10 crore people fall under the poverty line because they cannot afford to pay on time. And this is a vicious cycle in itself. Because they can't afford to pay, they delay care. And when they delay care, the cost only increases and makes it worse. So these are some of the challenges when it comes to providing care. So now, I don't know if you can see that. That's basically a World Health Organization data that talks about how many doctors there are in India for every 10,000. It's really small. So the question is, how can technology help? Now, like I was saying at the beginning, that I don't think anybody does any practice today without the use of technology. So the question is not, is there anything we can do with some basic technology? I think the issue and the challenge is, how do we apply technology in the most common areas of practice, in the most common day-to-day things that we do, so we take away the technology challenges, the access to data challenges, and enable providers and doctors to focus on care. Especially in primary care, that's important, because primary care is gradually becoming no longer just treating illnesses, but also helping with preventive care, wellnesses, and continuity of care. And all of those in turn reduce the need to deal with illnesses, overall reducing cost, overall increasing efficiency, increasing reach of the medical professionals. So when it comes to technology, we as technology providers, especially my company, focuses on delivering the basic services that are required for primary care providers. And that is not advanced devices, that is not some new ways to do specific services, but to deal with the day-to-day stuff. And the objective here is to essentially enable people to increase the efficiency, improve patient engagement with information and transparency, because patient engagement goes a long way in how well the treatment works. We all know that. And extend the reach of the physician in the community and across the region. Now, a couple of years ago, when we had the pandemic, there was an extensive use of telemedicine, and that gave doctors the ability to deal with patients that are not right in front of them, plus also got over the technical challenges of being able to provide acute care when it comes to somebody that has to be on the other side of a phone or on the other side of a laptop. Now, after the pandemic has passed, people have started going back to the providers because there is no alternative to sitting in front of a doctor, right? Telemedicine can only do so much. But telemedicine is here to stay. And then the question is, how do you integrate both in a way that it maximizes the benefit for the patient? Because one thing that's happening worldwide, including India, including with the Ayushman Bharat digital mission of the government of India, is that care is becoming patient-centric, not provider-centric. So from that standpoint, to provide continuity of care, to provide access to medical records as and when required, irrespective of where the patient is, to provide transparency, to ensure that the patient's care is taken care of with the latest information, latest access to data, requires, and ensure continuity of care requires a different kind of technology application in primary care. And one other area of importance is payments. There is no care without payments. So from that standpoint, India is one of the countries that has extensively used digital payments, and healthcare in India is one area where that has not been leveraged. And that's one thing that will go a long way in ensuring that people are able to pay, people have access to funds, and providers get paid in time, not delayed through various paperwork and bureaucratic process. And hence integrating all of that into a primary care ecosystem is very important to ensure quality of care. So essentially, if you look at that, then what we're talking about is a care network, essentially a capability to manage the health of the individual that includes acute care, that includes treatment of illnesses, that includes preventive care and so on, and continuity of care in a way that the provider can focus just on the care, and the underlying ecosystem, the technology, can take care of everything else. That's what we call the primary care network. It is a holistic, patient-centric personal health care management platform. And that's what we do, my company. And in some ways, we are probably the first ones to have a fully integrated health maintenance organization in the country. And we have focused on integrating health and wellness, labs, access to pharmacies and labs, medical insurance, because preventive care, subscriptions, and being able to manage your payments goes a long way in making sure somebody has good health care. And then, of course, all of the whole process of payments. So essentially, this is a completely self-contained ecosystem that enables somebody to get care, to manage their health, and for the providers and professionals and doctors and so on to be able to make sure that care is available as and when needed. So our first rollout of the ecosystem consists of access to primary care services, vision care, skin care, some of the ones that are ubiquitous, that are more required in this country, and electronic medical records and health trends, managing health trends. These are all key cornerstones of basic primary care. And essentially, from the standpoint of somebody using our platform, all of these are taken care of. All they need to do is focus on the care aspects of it. Sorry, this is a little bit jarring because I'm working with two laptops. And then, of course, IPD insurance and OPD plans, because today in India, you don't have insurance for OPD services. So from a patient standpoint, the line is getting blurred between IPD and OPD. And to be able to put together a healthcare plan that manages that, integrated in a way that continuously, seamlessly goes across hospitalization and outpatient services, is a big step forward in primary care. Then the third is access to laboratory services. If you're a primary care practitioner, most often people don't have access to care, don't have access to labs at the clinic. They're asked to go to a lab somewhere. Now, to be able to provide that at the clinic to the patient in a way that there is continuity of care, there is access to that data as and when required, continuously electronically, goes a long way in ensuring that there is timely access to information, the results, the reports, and then be able to provide care. Similarly with pharmacy services. And from the standpoint of payment, to be able to provide the convenience of UPI payments, the convenience of scan and pay and card pay and RuPay payments and so on, today is there everywhere. You can buy a cup of coffee with scanning and paying from your phone But when it comes to your medical care, it's not that easy. So to be able to integrate all this and provide this in a way that a provider or a primary care physician just signs up, uses the platform, is very fundamental to providing quality of care. And that's what we provide in our ecosystem. So today, the integrated health network operates. We have a number of virtual online services, online providers. We have about 12 physical clinics that we're expanding out in Bangalore and other cities in the country. And essentially, any member on our network can access care anywhere in the country, anywhere at our points of service, get access to labs, get access to virtual and in-person care, and be able to get access to their ABDM data as well, because we are a certified partner with Ayushman Bharat. So in short, essentially we are putting in place an ecosystem, a network for primary care where the provider can, all he or she needs to do is to subscribe, sign up, and participate. And they have all of the digital tools, all of the electronics tools, all of the data access, information, patient data, communication capability to manage primary care. So our services are both online and, like I said, you can walk in at any of our clinics. Today they are open in Bangalore and a couple of other cities, and they are expanding to other parts of the country, and makes it easy for anyone to provide standardized care, get access to medical records, get access to data, ensure the communication is consistent across all their patients. So the quality of care, the affordability of care, and the timeliness are all addressed using digital technologies. When it comes to actual planning for care, we provide a complete set of healthcare plans, like I said, outpatient services, inpatient care, and pharmacy packages, and so on. So that way, either the provider can put together a plan for the patient, or the patient can sign up, and now they can have access to care across the whole network. And today we provide 100% cashless payments, which is becoming an IRDAI requirement for insurance payments. There is greater push across the country to do 100% cashless payments, whether it's within the insurance network or outside, and we have managed to provide that. And from that standpoint, a patient is no more, when it comes to getting services, no more limited to a particular set of providers, a particular set of pharmacies or other services, but can avail them anywhere in the country. So how can primary care physicians participate on the network? It is as simple as subscribing to your Netflix service. It is as simple as saying, I want to be a provider on the network, or I want to run my own clinic on the network, or I have my clinic, I need some pharmacy services or other support services. It's a flexible ecosystem, so anyone can, depending on what they do today, how they practice, can require and request that kind of subscription service and participate. And when that's done, they can provide a highly standardized, highly qualitative care to the patient anywhere in the country. And this includes both in-person care with somebody walking into the clinic, or a patient across the country. So essentially, it is a complete ecosystem, and so participation can be one of many different ways. You can participate as a provider, you can participate in terms of running an entire clinic, or just leveraging our support services. So we're taking the technology challenges, we're taking the data access challenges, the payment challenges away from a primary care physician to ensure that they have access to all of the support and let them focus on the care. And we do that in a standardized way, in a way that All of the documentation requirements are met. All of the payment challenges are met. The insurance care provided. And so they can just focus on continuity of care and quality of care for a patient. In summary, you're essentially leveraging the power of the digital network to provide care, affordable care anywhere in India. Thank you.